So I'm a big fan of movies and web series, and as a therapist, every time I watch any movie or web series, I'm always looking out for different mental health situations or messages that I can take from there and share with my followers. So today I'm going to talk about this recent web series called Kaala Pani, and there is a character called Jyotsna, and whatever she goes through in the first 3 episodes clearly links to PTSD and C-PTSD. PTSD is post-traumatic stress disorder. It is a mental health condition. And I'm going to use this video and of course some clippings from the web series to simplify and help you understand this concept of PTSD, what causes it, how it affects a person, and what can be done about it. So as you see in this scene that you just saw right now, every time that Jyotsna sees a red car, she starts getting into experiencing something like anxiety or panic. As you see in the scene, her breath is changing, her heart rate must have gone up, and she seems to be extremely distressed when she sees a red car. Also, now if you see the second scene,
है पर अंदर से उतनी भी बुरी नहीं है। आजा। क्या हुआ? Jyotsna? Are you okay? Jyotsna? मैं पानी लेके आता हूँ।
The second scene also, when she sees a red car, again she is going through a very distressful feeling, and you can clearly see that she is extremely upset because it has triggered something in her. This is a classic sign of a person who has gone through severe trauma. When a person has what we call as PTSD, post-traumatic stress disorder, there are 3 things that the person experiences. One is of course re-experiencing trauma, which means every time the person sees or goes through any situation that reminds the person of that past traumatic experience, the body and the mind re-experience that same trauma, even if it is after 10 years, 15 or 20 years. So there is re-experiencing. There is also something called avoidance, which means these people will continuously and always try to avoid anything or any situation that will remind them of that past trauma. So in the series, as you see, Jyotsna tells this friend of hers that after what had happened to her, she cannot sit in a car, she cannot even drive a car.
कुछ साल पहले something happened. उस दिन के बाद से ड्राइव करना तो छोड़, मैं किसी कार के अंदर तक नहीं बैठ पाती। सब कुछ एकदम परफेक्ट नहीं है मेरे। I'm neither engaged nor working.
She always avoids cars, and specifically red cars. This is classical sign of PTSD, which is called avoidance. And the third sign is a constant sense of threat. So these are the people who will always be hyper vigilant and constantly looking out to avoid situations that may re-traumatize them in the same way that they were traumatized before. So these 3 things are clearly seen in Jyotsna. Now, why this is happening to her? As we watch the episode further, we will know that she had gone through a very traumatic experience where she was in a red car, trapped in a red car or hiding in a red car, and she sees her best friend being killed, murdered in a very brutal way.
I just couldn't. I couldn't.
So clearly that was an extremely traumatic situation that happened while she was in a red car, and obviously the mind and the body are now associating red color and red car with severe trauma. Once a person goes through a traumatic event, if it is a one-off event, then we call it a simple PTSD, and it is relatively not as damaging. But when a person goes through series of traumatic events back to back, then sometimes it becomes complex PTSD. In complex PTSD, the person's functionality and sense of self are also affected. So if you see Jyotsna here, in her situation, her trauma was so severe that her functionality, her ability to function in the profession that she was working also got compromised. So if you listen to what she tells about her life, after the traumatic event, she gave up her job as a nurse. She could not work anymore after that. She also started distancing herself from her friends, her relationships, and was even going to sell off her home and move out. So this is what we call as functional impairment, which happens when people go through severe trauma. Their ability to get up, do the work they are supposed to do, or even function as normal human beings is compromised. Their relationships also get compromised, and oftentimes they also have a low sense of self-worth. They feel they are not good enough. There's a sense of fear and shame. So this is about PTSD, and Jyotsna clearly demonstrates how she has gone through PTSD, and everything else that she is shown about her in this series shows how we can understand PTSD. Now, the behaviors and symptoms of PTSD are quite similar to borderline personality disorder or ADHD. So many times people are misdiagnosed with BPD or ADHD while actually they are having PTSD. So in India, in fact, the understanding, assessment, diagnosis and treatment of PTSD is not yet that advanced or developed as it is in the West. In fact, overall also in the mental health community, the understanding and awareness of how to diagnose PTSD, how to differentiate between simple and complex PTSD is still not so common. When we look at research says that well, one way to work with PTSD is trauma-centric CBT, trauma-focused cognitive behavior therapy, or EMDR, which works on the eye movement. Both these approaches require anything between 8 to 12 client sessions. But what happens is with these approaches, there is a higher dropout rate. So most of the people with PTSD are not able to complete their therapy sessions. And also learning these methods is also very complex and difficult. But a recent research done in the UK now shows that when it comes to PTSD, then something called RTM, reconsolidation of traumatic memory, is a wonderful modality which requires fewer number of sessions, and it is very effective to work with trauma or patients who come with symptoms of trauma. We at Wellness Space have been using RTM in our training modules. We teach RTM to our therapists, and we also are doing our own research on using RTM for working with people who have trauma. If you see in the web series, a sort of RTM happens when Jyotsna now, because of another severe traumatic event, actually goes into a red car and starts driving it, this time in order to save a little girl. So what happens is, this is how RTM works, is that in RTM we recognize an old association that is traumatic, and we now bring it up and reconnect it with a new association. In this case, red car was associated with death and trauma, but now Jyotsna uses the same red car to save a young girl. In my opinion, this is how automatically situational RTM happened, reconsolidation of traumatic memory happened, and hopefully after she drove that red car to save the girl, she would now not be experiencing the same trauma of a red car as before. This is my belief and my understanding. Well, in a therapeutic situation, we do something very similar, where we allow the client to connect with the trauma memory, and we reassociate, reconnect it, reconsolidate the trauma memory so that it stops affecting the client so severely as before. And this is the very simple way to explain RTM. If you are a mental health practitioner, if you wish to learn RTM or know more about it, please DM me or check out our training programs that we have on this. And if you are somebody who is suffering from PTSD, you are a victim of trauma, then please take help. I hope this video was useful.